Hey, Caleigh, what do you got in your mouth?
Choking hazard.
A what?
Choking hazard.
Yes, that is my youngest, Caleigh Bassett, but don't worry, she survived. She didn't choke. She's now in nursing school. Last week, we talked about what to do if your child swallows a foreign body. This week, let's talk about something even more dangerous when your child inhales a foreign body and gets it stuck in their airway or throat. But first, it's time for your weekly pop quiz. Oh, come on, let's see how you do this week. Question number 1, the most commonly inhaled foreign body for kids in the US is a food. Which food is it? Is it popcorn, peanuts, a piece of meat, or hard candy? The answer is peanuts. They're small, smooth, hard, and very easy to inhale. Kids may be laughing or talking when they're eating, and a peanut slips down into the lower airway or lung. So always supervise kids when they're eating. No laughing, goofing off, or running around while eating. And these small, hard foods shouldn't be given to kids less than 4. Question number 2, which inhaled food causes the most fatalities for kids in the US? Is it grapes, apples, bananas, or hot dogs? The answer is hot dogs. And this should have been an easy question. Hot dogs are the perfect size and shape to be a choking hazard. Even if they're cut up, a piece can slip down into the main windpipe and close off the airway completely, causing choking and sadly, ultimately death. All right, now if you didn't get that one right, I know you're going to get today's final question. What's the most common non-food item that causes fatalities in US kids? Is it latex balloons, toys, coins, or the rubber gloves that you all steal from my office? And I'll tell you, if you keep doing that, you kids are going to be in big trouble. The answer is balloons. Balloons are not a toy. They're soft, moldable, and they conform to the shape of the airway and close it off completely. Rubber gloves, same thing. We really don't recommend children play with either rubber gloves or with balloons. I hope you got the right answers. Of course, all of these items are choking hazards. I think this is a really important topic because choking is the leading cause of accidental death of kids less than 3 years old. So today we're going to discuss who's at risk, what the early warning signs are, and what to do if your child has a choking episode. I also do recommend, and I want to say it right up front, everyone should take a CPR course. Grandparents should take a CPR course. Learn this information before you need it. You will save a life. Kids with the highest risk of choking are those from infancy to about age 3 or 4. Infants, as everyone knows, put every single thing they find in their mouths. But it's toddlers, ages 1 to 3, who are at the very highest risk. They put things in their mouths all the while running around, laughing, and basically acting like idiots. Plus, at this point, you may think you know them. They can handle eating a Cheerio without being supervised, right? Wrong. Don't trust these kids at all. Other risk factors include being male. Just like with swallowing objects, males more commonly will inhale and get something stuck in their airway. Also, another risk factor people don't think about is having an older sibling. Older kids often leave out toys or small items. You know, those eyeballs or shrunken heads or 38 special ammunition that older kids love playing with. Make sure your older kids are also on the same page in keeping these small items out of reach of their younger siblings. But seriously, we discussed the type of items that you might ingest, smaller items that slip all the way down into the lung and cause a long-term infection, or larger items like hot dogs or grapes that get stuck in the upper airway and can cause difficulty breathing and fatalities. A good rule of thumb is that if an item can fit in a toilet paper tube, it can be dangerous. So taking that all into consideration, make sure you're supervising your kids while they eat, that they're sitting calmly and focusing on eating while they're at the table. Make sure that they have appropriately sized food for their size and for their age, and make sure that small items are out of reach and they're not putting them in their mouths. Now let's get to the type of symptoms you might see with someone who's choking on an object. Here's a layout of the respiratory system. 2 things might happen if your child inhales a foreign object. First, if they inhale a large item that obstructs the trachea, the main airway, this can be an emergency because air can't get down to either lung. These kids will have a sudden onset of coughing or gagging. They have noisy breathing, stridor, which is that kind of sound. They might have wheezing or a voice change. Do not slap the child on the back. Do not give them anything to drink to try to wash this down. And if they're still able to cough or talk, just observe, try to keep them calm, and watch for them to clear the item. If it's obstructing the airway a lot, then they may panic, be unable to speak, or even turn blue. And if it's completely obstructing the airway, they may clutch at the throat or make no noise at all because there's no air moving. For any of these sorts of symptoms, that's an emergency and you want to call 911 and start CPR if you know it. That's why it's important to learn that before you need it. Often a kid will start with these scary choking symptoms and then seem to clear it and be okay. But I strongly recommend you still have the child see the doctor right away. And that's because of the second type of problem from inhaled items. When a smaller item is inhaled, the child may start with a choking episode, seem to clear it, and seem fine afterwards, but that's because the small item has actually slipped down into the lower airways or into the lung to cause problems days, weeks, or even months later. These kids often get a persistent nagging cough after a choking episode or a wheeze that doesn't improve with asthma medicines. And these items have been known to sit in the lung for months, causing recurrent infections in the same area of the lung. They may have foul breath or cough up pretty nasty sputum from the item just festering down there. So if your child had a choking episode in the past and they keep having nagging, persistent coughing, make sure you take them to your doctor and let them know that you're concerned there may be a foreign body retained down in the lung. At the doctor's office, we'll ask a bunch of questions. We'll take a listen to the chest. An obstruction may cause noise with breathing or wheezing, or if you've swallowed a whistle, there may be some whistling sound. Or if the item's completely blocking up one side of the chest, there may be unequal breath sounds between the lungs, with the blocked up side sounding quieter. Then we'll get a chest x-ray. Metal and dense objects often show up very well on an x-ray, like these two nails that are stuck in the right main and left lower bronchi, or this dental crown, or these various metal objects. These are all dense and metallic, and so they show up well. However, most objects do not show up well on an x-ray. Remember, peanuts are the most commonly inhaled item, and they do not show up well on an x-ray. See the peanut in this photo? Yeah, me neither, but the x-ray may show other clues that there's a foreign body. Here you can see the left lung is darker and much more inflated and larger than the right lung. Also, the heart is being pushed over by this inflated left lung to the other side of the chest. And that's all because something is trapping air inside the left lung. Let's superimpose the lungs and airways here. If the child inhaled something that got stuck down somewhere around here, then air will get trapped in the left lung and cause this sort of x-ray picture. So this is a clue that there's a foreign body down there, even if the object is not visible in the x-ray. Here's another on the left side, and here's one on the right side. And sometimes, unfortunately, the x-ray will look completely normal. So a normal x-ray does not mean there isn't a foreign body. We might actually have to do a CT scan or have the friendly neighborhood surgeon look down there with the bronchoscope and see what he or she can find. If it's decided that an item is in the airway, it has to be removed by using a bronchoscope, because if it's left in there, it could cause worse obstruction, and it'll definitely cause an infection or possibly even chronic lung damage over time. Just for fun, here's a great picture of a whistle blocking up the airway, and there it is after removal. Prevention of choking is, of course, of utmost importance. So again, as far as food safety, supervise meals. Make sure the child is chewing thoroughly and eating slowly. No running, playing, or goofing off during mealtime. Make sure you feed foods with the appropriate size and hardness or texture. Cut hot dogs lengthwise and then cut them into small pieces. Make sure you cut up grapes too. And avoid nuts, popcorn, and other small, firm foods for kids less than 4 years of age. Regarding toy and other object safety, read and obey the safety instructions on toys. They're there for a reason. Avoid toys with small detachable parts and throw out any toy that's broken or has loose parts on it. Keep small objects, including coins, batteries, and magnets, out of reach, and use that toilet paper roll test. The final word, learn CPR. Everyone taking care of a child should learn it, and you should also encourage your child's school or daycare workers to have CPR training. Thanks for watching today. Subscribe and like, and make sure you check out the rest of our library of children's healthcare videos. Come back next Sunday. We put out a new video every Sunday at noon. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.